Hello, my name is Dennis Gorman, and today I will be discussing the causes, symptoms, and treatments of major depressive disorder. I myself suffer from major depressive disorder and am barraged by intrusive thoughts daily. An illustration of this can be seen in Figure 1. Genetics and stress can cause major depressive disorder with symptoms ranging from consistently low moods to low appetite, which can be treated using medication and psychotherapy. There are 3 key points I want to go over for this topic. First, I want to look at the causes, then discuss the mental and physical symptoms, and finally address treatment options. First, let's begin by discussing the causes. Stress is a big cause of major depressive disorder. Stressful events can make one more vulnerable to major depressive disorder, especially early trauma in life. Other mental health conditions like anxiety can also exacerbate major depressive disorder. Genetics also plays a key role in major depressive disorder, as how one responds to stress is linked to genes, meaning some people are more sensitive than others. And these traits can also be passed down through generations, meaning if you have a family member who struggles with mental health problems, you are also likely to acquire some sort of mental health diagnosis in the future. In summary, major depressive disorder can be caused by stressful events and trauma, and people with family histories of major depressive disorder are more likely to acquire it. Now that some causes have been identified, what are some of the symptoms? Major depressive disorder can cause many symptoms that heavily impair one's ability to function. The Diagnostic and Statistical Manual of Mental Disorders lists the symptoms of major depressive disorder as depressed mood, as can be seen in Figure 2, low interest, weight gain or loss, or appetite gain or loss, sleep problems, noticeable restlessness, or the opposite, fatigue, feeling worthless or guilty, reduced ability to concentrate or decide, and finally, suicidal thoughts or actions. To be diagnosed, you must have 5 or more of the previously mentioned symptoms, as well as have them for at least 2 weeks. Not only does depression cause mental symptoms, but also physical ones, mainly linked to stress. These stress can cause an increased heart rate, muscle tension, and fast breathing, which, if sustained for a long period of time, can lead to high blood pressure, immune problems, and cardiac issues. So, major depressive disorder symptoms are far worse than just feeling sad. They can lead to negative health symptoms if left untreated, and even suicide. How can someone be treated? The first recommendation for treating major depressive disorder is often psychotherapy or talk therapy. In talk therapy, you would go see a therapist, talk about your problems, learn where any cognitive distortions might be coming from past experiences, and learn coping skills like breathing exercises and relaxation techniques in order to get by. CBT, or cognitive behavioral therapy, has been shown to be very effective in both short and long-term treatment. In terms of medications, if therapy does not work, one might be prescribed antidepressants, as can be seen in Figure 3. It's recommended to still go to therapy if you are using medications, though. Up to 1 in 3 people, or major depressive disorder patients, have treatment-resistant depression, meaning that it does not respond to traditional antidepressants. So, an article titled "Ketamine and Treatment-Resistant Depression" by Professor Jennifer Lent cites multiple studies in which ketamine has been shown to be an effective antidepressant when others failed. So there are a variety of options available for depression, ranging from therapy to various types of medication. Now let's move on to concluding statements and one final message. Depression is a mental health disorder often caused through genetics and being overly stressed, with the trademark symptom of being sad. It can be treated, however. Figure 4 displays various statistics related to major depressive disorder in the United States. I myself have in the past tried many different medications, but none of them worked for me personally. However, therapy has shown to be very useful for fighting against those intrusive thoughts and learning to accept them rather than try to push them away. From personal experience, I know it can be difficult to seek help when you're depressed, but if you believe you are depressed, please seek professional help as soon as possible. There is hope for those struggling. Don't give up. You can ask close friends or family for help. Just remember that you are not alone.